And welcome back to the morning show. It's time for our morning rounds. Eligibility has opened for many groups to get the vaccine, but kids younger than 16 still cannot. We're learning why with pediatrician Dr. Alexis Orama from Christie Clinic. Good morning, doctor. How are we doing today?
Good morning. Nice to be back.
Excellent. We are happy to have you back here. You bet. So first and foremost, why can't kids get the vaccine yet?
So children are a more vulnerable population. Initially, when coronavirus began, it was affecting adults, the older population. So studies were focused on, those clinical trials were focused on, decreasing risk in that population of elderly who were getting severely sick. And not until vaccines are trialed and shown to be effective and low risk to adults can they then be introduced and trialed on children. So the protocols for children are a lot stricter.
So when can children get the COVID-19 vaccine?
So what it's looking like at this point is recently the FDA they allowed the emergency use authorization for ages 16 and up for the Pfizer and 18 and up for Moderna. So it looks like the older high school age and those young adults going into college are able to get it. But the good news is that they are just this past Friday, April 9th, they applied for use in 12 to 15-year-olds. So if the FDA allows that emergency use authorization, in that younger population, if that is broadened, then preteens and adolescents will be able to get that vaccine. It's looking like maybe this fall in preparation for the next school year. Trials are underway in younger children, and some of them began late in 2020. So I imagine the data will be available probably the second half of the year. So that may take a little bit more time before we know, maybe early 2022, before we know whether younger children will be eligible. But for now, what's positive is that this, preteen, middle school and high school students may be looking at getting vaccinated for the upcoming school year. And what's exciting about that is so far the studies are showing that the vaccine has been highly effective and actually has conferred more antibodies than it has even in adolescents and adults, which is really great news for parents who are concerned about their children getting the vaccine.
Wow, that's great news right there. So if a child has already had the coronavirus, do they still need to get the shot when that may become available?
So I'm glad you asked that. So a journal published in March in one of the medical journals published called JAMA actually showed data saying that the vaccine will confer more protection than having had a natural infection, so having had a COVID-19 infection already and having had antibodies or the convalescent antibodies, which were being used for treatments in the beginning. So even though someone has had an infection, yes, the vaccine, so far the data is showing that it will give better protection and more long-lasting protection. So for all children and loved ones who have had coronavirus infection already, we're definitely going to recommend that they have the vaccine as well.
And at this point, it's all about reducing that exposure. How do we reduce exposure for kids before that vaccine is available?
So it's definitely been a long year, and it's been over a year of our lives now. So I don't think there is a way to eliminate the risk or the chances of getting exposed, but definitely minimizing it, like you said, reducing. So I think all parents should be asking themselves how to allow your families and your children to live life, but be smart about mitigating that COVID-19 risk. So when you approach plans, try to kind of keep that in the back of your mind. This summer, maybe take trips where you can distance, do more things involving the great outdoors and less, inner city exploring, less crowded places. planning for road trips. But if that, airplane travel is warranted, maybe avoiding high travel day, very popular travel days like, July 4th or Memorial Day, those peak travel times. And still, I would discourage, large gatherings, keeping get-togethers small, and just continuing to emphasize to your children to wear masks, to wash hands, to sanitize. But I think, ultimately it's about, realizing that there's always going to be a risk, but what it is, figuring out what we can do to lessen that risk and minimize our children's exposure to COVID-19 as best we can.
All right, doctor, thank you so much for your time. We appreciate talking to you this Tuesday about this very important issue.
Yes, thank you. Have a great day.
Have a great week. Jack has your forecast next. We'll be right back.